Good afternoon. My name is Dr. Dennis Taylor, and I'm the president of the North Carolina Nurses Association. Just a couple of housekeeping instructions. Participants, please write your questions in the question and answer box or use the raise your hand icon if you have a question for our guests this afternoon. The staff at NCNA will read any questions and/or recognize you if you've raised your hand. To improve the quality of our call, all participants will be muted until recognized by our staff. When recognized, please make sure your microphone or your phone is unmuted. Governor Cooper and Secretary Cohen, thank you for joining our call today. On behalf of the Board of Directors of the North Carolina Nurses Association and Dr. Linda Stone and the Board of Directors of the North Carolina Association of Nurse Anesthetists, I'd like to personally extend our thanks and appreciation to both of you for your leadership through this pandemic and for your time today. We appreciate the opportunity to be active participants on the DHHS COVID-19 Healthcare Coalition. After Governor Cooper speaks and Secretary Cohen speaks, Secretary Cohen has agreed to take a few questions. We'll turn it over to you, Governor Cooper.
Thank you, Dennis. I am truly humbled and honored to get to speak to North Carolina nurses today. You're spending your time caring for patients and saving lives, and I know that this is an extremely challenging and anxious time for you and your families right now. One of the main concerns I know that you have is the availability of PPE. And Secretary Cohen and I want to tell you that that is a top priority for us. We're working hard to find new sources of PPE all over the globe. And we're also partnering with manufacturers here in North Carolina to increase production, because we know that you need to protect yourselves when you're seeing these patients. We're seeing more and more of it come in to our state, but the supply lines are stressed. And so just know that we're working on it as hard as we possibly can. We're also making sure that we're surging up to have the hospital beds so that we are not overwhelmed. And we're also doing everything we can to make sure that you have help on the front lines. And since this is an emergency, we're having to take some additional steps that we wouldn't normally take, but we know we need to now. And we're trying to get more healthcare workers into the workforce, allowing professionals now who are licensed in other states but not North Carolina to practice during this time, getting retired or inactive healthcare professionals to be able to provide care, and allowing skilled but unlicensed volunteers to provide care, and even allowing some students to provide care if they are at an appropriately advanced stage of their professional study. So we want to work to try to get you help. We also know that this has impacted your family life and has given you significant challenges. And we know that maintaining access to child care for workers like you is an urgent need. And therefore, Dr. Cohen's department has worked really hard, and we've developed financial support for parents and providers to make sure that you can stay in business. And we've done that through an emergency child care subsidy program. This will help people to get child care, people who are on our front lines like you. Financial aid is available to parents and caregivers who are essential workers who meet certain guidelines, and Dr. Cohen can give that information to you. I want you to know that I have put these interventions in place, like bans on mass gatherings, like closing certain businesses, like letting schools out for a while, and like stay-at-home orders, in order to keep you from getting overwhelmed. And I think the people of North Carolina are doing better and better adhering to them. and we are hoping that we can flatten this curve so that you all can handle the amount of people that come in. I just thank you from the bottom of my heart. You are true heroes. I'm grateful for every nurse who's ever taken care of me. I haven't been sick very much in my life, but I've been grateful for you when you were there. And your job is hard enough on a regular day. Now with this virus infecting the globe, your job is that much harder. And I am truly grateful for you. And we're going to continue to work hard to give you what you need and to try to keep you protected and to try to slow the spread of this virus. We're very fortunate to have Dr. Mandy Cohen as our Secretary of Health and Human Resources. She was a practicing physician for a number of years and is an expert in healthcare administration. And we've gotten her to North Carolina here with her family, and she's doing an amazing job right now. So, Dr. Cohen, you might want to say a few words to these great North Carolina nurses.
Well, thank you, Governor. And I think most importantly of my background, and many of the nurses know this, is my mom is a nurse. And so much of what shapes how I think about my clinical experience and how I even respond to this is so much grounded in what I saw of my mom giving every single day as she was a nurse and then a nurse practitioner. And in her work. And I know there is nothing more important than us being able to do everything humanly possible to get the protective equipment that you all need so that you can do your job. We know that that is top priority, a top concern of yours. And the reality of the situation is this: there isn't enough protective equipment right now. The supply chains are not there. You well know in this national global crisis time, but we are not sleeping until we get all of the things that we need to protect you. And I very much know that is top of mind. But we also know that there are other important issues, a couple others to bring up. One, in the governor's executive order, he mentioned that he provided some additional flexibilities to make sure we have the workforce being able to respond. One of those flexibilities was giving some authority to the Nursing Licensing Board to offer some additional flexibility in this area. The Licensing Board does need to take action, but they can do it in a much more rapid fashion instead of going through an extensive rulemaking process, and we encourage them to use those flexibilities to make sure that we can be as responsive as a state as we can to this crisis. The other thing to bring up that I know folks have asked questions about is around testing. We know that we want more and more testing to be available. Testing has been a problem from the beginning in terms of supplies, again, as well as having the protective equipment for you all as we do that testing. But I think North Carolina has actually been a leader in testing given all of those limitations, and we have done a lot of testing, and testing is going to continue to be very critical, and we have some very focused work on ramping up additional testing, but that has to come with also the protective equipment. So we are trying to really focus in on testing that maybe the patient can self-administer, again, so it doesn't require the PPE, that the protective equipment that is needed for some of the current testing methods. So those are all things that are top of mind, I know, to you, and wanted to make sure you knew are top of mind to us as well. I wanted to reiterate that the governor mentioned that child care subsidy. We stood up an emergency child care subsidy program specifically for our healthcare workers and other frontline workers. So folks who have financial need, if they go to our website, which is dhhs.nc.gov/coronavirus, there's a section on there around child care, and there is now a form that you take. You just fill out that form and you take it to your child care provider of choice. We have a hotline that's right there that you can call to help match you up if you need a new child care option in your neighborhood or near where you work. So there are a number of child care settings that have closed, but we have worked really hard to keep quite a number open and are taking new folks. And so we hope that that child care subsidy program will be helpful, particularly for our nursing community, so that you can be where you're most needed, which is on the front lines, being the heroes that you are every single day. So with that, I just want to thank you again for all that you're doing and for the time you're taking on this call today. So I'll turn it back over to you, Governor, and back to the rest of the nurses for some calls. I'm sorry, for some questions.
So Dennis, were you going to provide some questions for us?
Yes, sir. Yeah. The first one is, we are hearing a lot from the frontline nurses regarding the flexibility of the workforce. As you know, with a lot of the shelter-in-place provisions that have occurred, folks that are working in non-urgent, emergent settings, a lot of them have seen their volume of patients go down significantly, which has created some healthcare systems doing layoffs and furloughs. Is there any communication going forward, either from your office or from DHHS, that is encouraging employers to be very flexible with their HR rules and regulations to allow licensed healthcare providers to potentially work in areas that not traditionally they would work in, so that they could keep their hours up?
Dr. Cohen, you want to take that question?
Sure, absolutely. I love this question because it is very much in line with what we were thinking. We know that folks are having some of their hours reduced or maybe even experiencing some layoffs, but we know that you are skilled. We know that you want to help, and we want to capture that. So I don't have details today, but this is where I'd love to work with the Nursing Association on some additional plans here on how we can help folks get redeployed to places where we might need them. I will say a particular need very urgently is around some of our long-term care settings. They are, our nursing homes see some of our most vulnerable folks in there, and they are experiencing outbreaks as they see some of the virus come into their settings, and they see some of their workers come down with the virus and obviously can't be working. So they are very much in need of some support. So we would love to, and I'll take this offline with Tina and others to figure out how do we match up the need with those of you who have the ability to do that. We have definitely made flexibilities available through the executive order to make this possible, and if there are more needed, we will work through that. So thank you for bringing that up, and we want to definitely work in that direction quickly.
Thank you. We have some other questions. Sarah?
Yes, I'm going to open the line up for Linda Stone, the president of NCANA.
Hello.
Linda, you should be live.
Can everyone hear me?
Yes.
Okay, great. Well, first of all, I want to thank you, Governor Cooper and Secretary Cohen, for your leadership. We all really appreciate it. We know that you have a lot on your plate that you're dealing with because you are doing this on behalf of all the citizens in North Carolina. One of the things that I wanted to address was, again, to bring it to your attention, was that our CRNAs are, as you know, and the certified registered nurse anesthetists are on the front lines, keeping the ORs running and functioning well for surgical cases that are being brought to the OR. We are uniquely trained to deal with high stress, dynamic situations that require critical thinking and quick, effective action, airway management, ventilation, rapid assessment, intervention, etc. What I want to bring your attention also, actually, to echo Dr. Taylor's concerns were the workforce concerns. Many now CRNAs, because the elective cases have been reduced or actually eliminated in many areas, are being offered furloughs and leaves of absences without pay. They are also having their salaries reduced for the same number of hours worked, and many are being redeployed to other areas where their unique skills are not being fully utilized. And so basically what I wanted to say is we hope that we can remain in contact with your offices during this crisis to discuss these issues and to see what solutions we can address with you together. Again, thank you very much.
I appreciate that. And, the medical providers, the hospitals, et cetera, are in a tough situation here because everybody is getting ready for this surge to come. And what they have to do is to empty beds in order to do that and reduce all of these elective surgeries. And that, of course, leaves a lot of empty beds right now while we wait for the surge. We hope that the surge never comes. But we really know that we're going to need this workforce, that this COVID issue is going to be with us for months and months. And it's important to keep the workforce strong and in play. And Dr. Cohen and I were talking to some hospital CEOs today about this issue and encouraging them. They're concerned about the bottom line of having so many empty beds and not being paid for them, but we're working hard to try to get more money to medical providers so that they can try to keep on as much of their staff as they possibly can. And I know Dr. Cohen wants that to happen as well.
Thank you, Governor. This is Tina Gordon with NCNA. I'm reading a question that's been submitted in writing. This crisis is making health inequities that we face even more apparent. What are you doing or planning to do to leverage this increased awareness to make equitable access to healthcare and wellness available for all North Carolinians? And how can nurses and APRNs help you create these solutions?
Thank you for that question. Oftentimes, a crisis puts a spotlight on problems that were already there. And you nurses on the front line see every day the health inequities that are there in our population. Dr. Cohen and I both, and your organizations have been helping us. Every North Carolinian should have health insurance. And now with this pandemic that has occurred, we see now how it would have been so much a better situation if we'd had 500,000 to 600,000 more North Carolinians covered with Medicaid through Medicaid expansion. This shows that we need every person to have health insurance, and we need to close that coverage gap. And this is going to provide more fuel for us to push for Medicaid expansion in North Carolina. I've also sent a letter to the president today and to Secretary Azar at DHHS to open back up the Affordable Care Act, the marketplace, because a lot of people are sitting there without insurance and they desperately need it. We've also asked for some Medicaid waivers that would get more people health insurance, and we're going to keep fighting for that. And I know, Dr. Cohen, you're working on some other things as well. Let me say this, folks. I have to get on the next phone call that I have that was supposed to have started a little earlier than this. So Dr. Cohen's going to stay online to answer some questions. But I'm really grateful to each and every one of you. And we're going to keep working hard to save as many lives as possible. And we're grateful for your good work. Dr. Cohen, I'll turn it over to you.
Great. Thank you, Governor. And Tina, just to add, I honestly don't think I could do better than what the Governor said. I think that's why he and I have been working so hard for 3 years, not just on Medicaid expansion and advocating for that and trying to get that done. And I agree with him that I think our state is unfortunately not in as good position to respond to COVID-19 because we have these really large populations that have not had insurance, which means their diabetes is going uncontrolled, their high blood pressure is going uncontrolled, their asthma is going uncontrolled, and we know COVID-19 affects those folks who have chronic diseases, and particularly those that are not well controlled going forward. And so, we've been working for more than 3.5 years on trying to work on health equity issues, whether it's in our early childhood action plan or others. We have been focused on these issues, and as the Governor said, a crisis trying to spotlight on things that were already broken in the system, and we just have to redouble our efforts on all the things that we've been doing across the department. And we have to remember that health is obviously more than just the what happens in the clinics that we see our patients in, right? It's the housing security, it's food security, it's having a job and ability to have access to health insurance. So all those things matter. I'm going to continue to be at the forefront of our work going forward in the short term as we respond to COVID-19, as well as our work for the future.
Thank you. And we have a question from Jan Tillman. So I'm going to open up your line, Jan.
Hello, can you hear me?
Hi, Jan.
Hi, I'm an academic faculty member at East Carolina University in the Doctor of Nursing Practice program. And so myself and several of my colleagues are, our expertise, we're nurse practitioners by trade, but we primarily work with larger systems improvement and public health needs. And we're some of us older, and so doing direct care may not be the best fit for us, but we want to volunteer in some fashion, specifically around helping with organizing healthier practices in our retail system, or working with nursing homes on solving some of their dilemmas in caring for their patients. Can you tell us how best we can be engaged with your organization and volunteer? Some of us have contacted the volunteer line, but of course it's very overwhelmed right now.
Yes, Jan, thank you so much. And I really appreciate the offer. And I think there are a number of different kinds of roles, even if direct clinical care is not the role that might be right for you or whomever. I think that there are a number of ways in which folks can continue to help. Yes, I would encourage folks to go to our website, and we have a volunteer form there where folks can go through a sort of a formal process that's a little bit more clinically focused. What I would say is that if you have the ability to help, and you're in ECU, I know that our local health departments certainly could use the support and some additional arms and legs, even if it's giving infection control guidance to some of our long-term care facilities or adult care homes. That can be done remotely. So my first advice would be, depending on where your home is and if you have relationships with some of your locals. If not, we'd be happy to match you up with local public health departments. We were just talking today about, they have so much on their plates, our local health departments, and we are working on a plan here at the state to continue to try to help make sure they have the resources they need. And we would love to partner with the nursing community and with the academic community on giving them a little bit more support, particularly those who are steeped in public health like yourself, Jan. So thanks for that offer. And I'm going to take it back and to my team and make sure that we plug some folks into that. So I really appreciate it.
Well, thank you, Secretary Cohen. I know your time is extremely valuable, and we do have a lot of written questions that folks have sent in. We have had upwards to about 270 or so folks join us this afternoon.
That's great.
And we're going to address the written questions as much as we can, and may reach out to your staff to assist us with some of the others. But we really appreciate so much for taking the time to share your insights with us today. Please know that both the North Carolina Nurses Association and the North Carolina Association of Nurse Anesthetists, along with all nurses and advanced practice nurses across our great state, stand beside you, and we're ready to put our education and clinical expertise to use to improve access to safe, value-directed, excellent care. Please let us know how we can help you and the leadership of our state during this pandemic and beyond. But thank you very much.
Well, thank you, Dennis, and thanks everyone who is on the call today. I know how hard the work is on a good day, and so we're now in a crisis, and so we need your support even more, and I'm so grateful for that such a kind offer to continue to fight together and work together on this. So we will definitely be talking a lot about how we can continue to make sure that is happening. Happy to answer more questions by over email as we go, and just want to tell everyone, to stay safe, to make sure that they're taking care of themselves through this, and as that we go into a weekend of holiday celebrations, that I hope everyone has a meaningful holiday, even if we have to stay distant this year and do things a little bit different. So I thank you for the time this afternoon and for all that you're doing.
Well, thank you very much. And for those folks that are still on the line, and those of you who have submitted questions, as I said, we will do our best to respond to those and to get back to you as quickly as possible. We appreciate everyone joining us today, and everyone please have a very safe weekend coming up.